I've been in a few different wards in the stake over the last 13, 14 years. I started out as a registered nurse for 7 years. Then the Army put me through the Army Physician Assistant Program, and I've been practicing medicine as a physician assistant for the last 27 years. I've been a team leader and a planning chief on a medical disaster team. And that's pretty much, I practice both emergency medicine and family practice. This is the reason urgent cares were created. You call your doctor, you're sick, your child wakes up sick, and you hear the words, "We don't have any doctor appointments till tomorrow," or next week or the week after. You call the doctor's office, your child has fever and earache, not eating well, fussy. "I'm sorry, the schedule's full, and we can see you tomorrow at 3 p.m. Hopefully the child's either better by 3 p.m. tomorrow or hopefully not too much worse. Doctors' offices, they're very busy these days, and they fill their schedules up sometimes weeks and months in advance. And the urgent care industry has thrived on this, but sometimes, for various reasons, urgent cares can have expensive copays, or they don't take your, just watching the moving screen. But, and so we're trying to go over some common things that you can do and recognize whether you or a loved one needs to be seen by a doctor right now. Can you wait till 3 p.m. tomorrow? You're in the evening, 9 o'clock at night, you fall and you cut your arm. Doctor's office is closed. Urgent care is closed at 9 o'clock, and it's past that, and the ER has a $200, $300, $400 copay. And what do you do? Life happens, and minor disasters happen to everybody. We can't predict them. We can live as organized as we want, and things happen, such as your kitchen flooding out. Being prepared the best you can. Having an immunization record and available so that if you're seeing somebody other than your primary care provider, having a brief medical history, having medications lists and directions available how you're taking those medicines, having the number for ER, nurse line, or poison control where everybody can see them, especially the babysitters, for those of us who still have children, and having a first aid kit and family members that know how to use the first aid kit. And then it's always helpful, children, their medications are dosed by weight, and so knowing the last or current weight of your child. Learning CPR and first aid. I've taught several CPR courses for John over the years, but it's something that's good to know. American Red Cross offers basic first aid kits, or first aid classes. Is there emergency action that's needed right now? Does the person have major injury, car accident, fell from a ladder, no pulse or not breathing, unconscious, having bleeding that won't stop when you're putting pressure on it for some time, stupor or drowsiness, disorientation, shortness of breath while at rest. Many of us get short of breath when we're doing things, but shortness of breath when they're just sitting there and rest, that can be a problem, or severe pain. You want to act as fast as you can think, and if you think someone has been poisoned, you need to call poison control. That's one. Poison control has a number of phone numbers. That's one of the phone numbers you can reach. When you talk to that poison control nurse, they're going to want to know how much did somebody take, how long ago was it, because time does play a factor. I saw a patient walk into an ER and say, "I just took an overdose of Tylenol." The ER quickly drew a blood level, Tylenol was next to zip. And so the doc said, nah, really didn't take it, sent the patient home, and they died. Because the patient didn't tell them that they were in the parking lot of the ER when they took the Tylenol. And so it hadn't even dissolved in the stomach yet. And so knowing when something happened and how much of something is important to poison control. Fevers. Most people speak about fevers and illnesses as if they're one and the same. Fevers are our body's defense trying to fight off an illness, whether it's bacterial or whether it's a virus. Your body's trying to raise your body temperature to kill the infection that you're having. And sometimes it's successful. It's one of the safety mechanisms that the good Lord built when built our complicated bodies so that our bodies would help fight off some of these illnesses. Normal body temperature can vary between 96.9, 97.3 to 98.8 degrees. That's an oral temperature. If you take a temperature rectally, it's going to be about a degree higher. If you take it in the armpit, which is called the axilla, it might not be accurate at all because skinny people will have a pocket there, and if you don't have skin on skin touching the thermometer, then you're going to get a highly inaccurate. Yes, ma'am.
What about the ones that you can buy and go across the forehead?
Okay, the temporal ones where you wipe across the forehead, if you buy a good brand, they're okay. There are some cheap ones that'll stick to your forehead that are colorimetric. They're not so good. But if you're spending, somewhere around $25, $30 for one of those, you're usually getting a decent one. If you're trying to buy one for $2.99, it might not work as well as you want it to. Vigorous exercise can raise body temperature, and that 103 degrees, that's somebody who's out jogging in the Arizona in the middle of July. In the ER that I work at, we treat a lot of people that are hiking in the summertime, running in the summertime, and they wind up with some heat exhaustion or heat stroke, and they come in and their temperatures can be very, very high at times. Persistent fevers. Most common cause is persistent viral or bacterial infection. You've probably seen yourself or with family members, somebody has a fever for a couple days, it's not extremely high, you give them Tylenol, and after a few days, the illness passes. When we're talking about persistent fevers, we're talking about fevers that are there for weeks, days, and sometimes weeks. If you're going past 3 days with a fairly significant fever, you probably need to be seen. Colds and sore throats can cause fevers. Ear infections, urinary tract infections. Pneumonia and appendicitis can cause significant fevers. A lot of people write off the urinary tract infection. If you're familiar with the church does the trek for the youth, and I was the trek doc once. And we had a young lady with a high fever. I wound up getting her transferred to the practice that I was working at the time. Fever turned out it was just because of urinary tract infection. Many people just have burning and frequency of urination when you're having a UTI, but some people, if the bacteria starts moving out towards the kidneys, you could wind up with some significant fevers. How high a fever is does not mean more serious illnesses. You can have a child with an ear infection. It's not a serious illness, but they can have fever sometimes 103, 104, 105 degrees. Viruses can cause low temperature fevers, normal temperatures, or high fevers, all from similar viruses. What a fever is does not indicate the seriousness always of the illness. Treating a fever, controversially. If you're treating a fever that's under 101, you're usually treating for comfort, because when you have that fever, you're feeling miserable, achy, And so fevers over 101, when we're talking on the medical side, that's usually where we're treating it for the illness that's going on to bring down the fever. Tepid baths or sponge baths work great. I come from an era where my father threw ice into a tub and said, we're going to bring down his fever very quickly, and put me in the tub. I was about 12 at the time. It brought my fever down, and it brought it down too fast, and I wound up having a seizure because of it. Febrile seizures are common if the fever gets too high, or if you bring it down too sharply, the person can go into a seizure. Tylenol or ibuprofen, no aspirin, especially with children. Yes, ma'am.
My mom always, when we had fever, when we were cold, she was rubbing alcohol on us. I've heard different pros and cons on that. About rubbing the body down with alcohol when you had a fever.
A lot of people have done that in the past, and the theory behind it is they're putting the alcohol on. The alcohol evaporates quickly. Doesn't always bring the fever down, but can sometimes make the person feel cold, or they feel better because of the evaporation. One of the things you have to worry about something like that, and that's just like too cold of a bath, if the person starts shivering or getting goosebumps, then their body's going to start generating heat and the fever is going to go up. So anytime you're trying to bring down a fever, you don't want to do anything that's going to cause the shivering or the goosebumps, because you don't want that fever going up. But a lot of people get a lot of comfort out of that evaporation cool feeling from the alcohol.
So that's kind of a risk then, in a way, to say, if you use alcohol?
It's probably not going to hurt them, but again, if they start shivering or getting those goosebumps, you want to stop that. It generally doesn't bring the fever down, it just brings comfort to the person. Febrile seizures that I was just talking about, they happen. They're scary because you feel helpless. The child or the adult or the person is flailing their arms and legs, and what you're going to want to do is protect the head, because you don't want that seizure making the head pound into the floor or nearby cabinets, depending on where they fall. And so if you can gently protect the head, let the head come back to and tilt a little bit back, that helps to open up the airway. And so while you're protecting that head and the airway is open, generally that person's going to be okay. Eventually the seizure is going to come to a stop. If it doesn't, then you're going to wind up calling 911. But most seizures only last less than 5 minutes. And it's not unusual for the person to come out of the seizure and having no memory of the seizure at all. And that's pretty much standard for the average person. If a person usually can remember the seizure, it wasn't a true seizure that they were having. And then after a seizure, they're going to feel tired for a couple hours. Anytime that somebody has a seizure, it's usually a good idea to take them to a doctor's office or an ER and have them checked out to make sure that there's nothing else going on that might have caused that seizure. Cuts, bleeding that you can't stop with pressure, numbness or weakness beyond the wound, inability to move fingers and toes, or lacerations that are fairly deep on the face, palm, chest, or abdomen. Generally, those type of lacerations or cuts, you're going to need to seek medical help for. You know, when we can't move a toe, you get a laceration across here, we've got tendons that attach that are called extensor and flexor tendons. And so if you cut the tendon up top here, they'll be able to move their finger down, but they won't be able to bring their finger back up because the tendon that pulls on that to bring it back up has been severed. And then the same with your tendon on the palm side. If you cut it in here, they could bring their finger up, but because it's been cut, they're not going to be able to bring that finger down. But if they're not able to move, they're going to need to see a specialist you go to the ER. If it's in the hands, a hand surgeon's going to put the tendons back together. If it's in the foot, it's going to be an orthopedic surgeon that puts those tendons back together. But if any of these things that are going on, you do need to see a doctor. Yes?
So if seeing a doctor is not going to be like an option in the next little while, what's your best case? Like, what should you do if going to a doctor is not an option?
If the doctor is absolutely not an option, if the bleeding isn't stopping, and especially if it's spurting, indicating that it's an artery that's been cut, you may have to consider using a tourniquet. If it's something like the tendon's been cut, you can splint that, you can bandage the cut, clean it with soap and water, and so long as a hand surgeon or an orthopedic surgeon is seeing them within a week, we generally don't want it going beyond 10 or 14 days, they'll still be able to put that back together. It's just the sooner they're seen by the hand surgeon or an orthopedic surgeon for a cut tendon, the easier the job for that surgeon to put it back together. Because the more time goes by, you're going to have retraction of those tendons, and so the surgeon's going to have a little bit more time on his hands trying to put it back together. Go ahead.
You just touched on one thing about washing with soap and water. Is it important to have some kind of plain, or because all the soap in my house is, pear or,
Or pear
I mean.
This time of year, evergreen.
Flavored soap, yeah, cinnamon soap, vanilla soap, it's all that stuff from the store. But can you wash it with those kind of soaps?
You can wash it with that so long as you're going to rinse it out well. The perfume that's in it may irritate the skin and with getting into the laceration, but we do want to keep that clean. But if you've got an antiseptic, hydrogen peroxide you can use, and that's good for the first couple times, but hydrogen peroxide will also break down the platelets that are trying to clog up the cut and stop the bleeding. And so every time you put that on, it kind of washes it away and the bleeding will refresh. But it's not a problem using it the first time. There's antiseptics called betadine that you can buy over the counter that are good. Sometimes the skin will, with that, turn a little orange for a little while, but that orange coloring will go away. But you can clean with that, and then when you're done cleaning with it, you can rinse it off with water. We don't ever want to leave the hydrogen peroxide or antiseptic or soap in there. You clean it and then you rinse it off, and then you want to cover it so that it doesn't get recontaminated. Yes, sir.
I've always heard this saying, the answer to infection is irrigation, or the cure for irrigation is, or the cure for infection is irrigation.
Okay.
And basically, I've been taught, you fill up a Ziploc bag or something like that with potable water, and then if you have like one of those little betadine swabs or even some hydrogen peroxide, you either throw the swab in there in the water, which is enough to dilute inside the water for irrigation purposes, or pour a little bit of hydrogen peroxide and then just cut off a corner of the bag to spray it out with pressure with gripping it, and you just spray everything out inside the wound. Do you agree with that?
I'd agree with that. If you're using the soap, you're going to irrigate the soap out with the water. If it's a few days old and you've got some pus and it's red, irrigating that out is going to help remove some of that pus that's in there. What the problem with the pus is, the bacteria will hide in it. And so you want to get that drainage and that pussy drainage out of there so the bacteria doesn't have a place to hide. If you put a person on, when we put people on antibiotics, we'll drain a wound and get that drainage out of there so that the bacteria is not hiding in the pus, and then when you're done the antibiotic, it just goes back into the tissue and reinfects. So irrigation is good. If it's the day you cut it, you're going to clean it with the soap and then irrigate the soap and everything out with the water. They have butterfly bandages, steri strips that you can buy, and what they do is they temporarily close the wound, but you've got to get the skin absolutely dry to put those on. And you can do it very successfully, but clean it out with soap and water, irrigate it with the water, dry, and then you can put the butterfly or the steri strips on to bring the edges together. Again, by bringing the edges together, you're going to decrease the chances of bacteria getting in there and decrease the scarring that the person has. Cover it with a light dressing. Too heavy of a dressing kind of defeats the purpose because we do want oxygen getting into that area to help with the healing. Broken bones. Not even a doctor can tell if a bone is broken. That's true to an extent. If the bone is broken and it's in two pieces, anybody with medical training can feel that, and they're going to feel the difference in the bone. And we know most fractures are a crack in the bone, and so it doesn't break into two pieces. And in those cases, you really can't tell without doing an x-ray if the bone is fractured. However, most bones are in line, and so they're not broken in two pieces. Protecting the injured area by putting it into a splint and putting it into a sling. And you can use anything. You can take newspapers, roll that up, and that'll be firm enough to use as a splint. And then you can use any kind of cloth to make a sling out of. You can use a shirt to make a sling, using the arms as the part that ties around here and them resting in their arm. You just don't want them moving it around, because when you immobilize the fracture, it decreases the pain. When they're moving their arm around and those tendons and ligaments are moving and pulling, they're in a significant amount of pain. And so just immobilizing it will decrease the pain tremendously for them. And then once you've put it in a splint and a sling, whenever you can, you want it within the next 14 days to have them seen. Even if a bone has to be reset, when we see them in the ER, we put a splint on them and put a sling. If we're sending them to an orthopedic surgeon, so long as they're seen by the orthopedic surgeon within 14 days, they're going to be okay. Beyond 14 days, the bone starts knitting, and then the orthopedic surgeon may have to break it and to reset it. Body part splint suggestions. The upper leg splints, you can tie the two legs together, so you're using one good leg for a possible break in the other leg to help immobilize that. Lower leg injuries, use a rolled up newspaper, baseball bat, broomstick handle. Ankles and feet, rolled up newspaper or magazines work really well. When you're concerned about a fracture to the back, the upper torso, the head and the neck, the hardest thing is the earth. If you wind up calling ambulance, you don't want to move them when they have a neck, head, or back injury. And so try to leave them in the position that they're in and call 911. The ambulance will come in with what they call a spinal board, and they'll slide that under them and then remove them. Immobilize the person by placing folded blankets and pillows up against them and secure them with belts, ties, or sleeves, remembering not to move a person if it's a back or head injury. Arms of umbrellas, stout sticks, canes, baseball bats, all of these work for splints. If you've got a fractured hand, using a tablet, anything that's firm and flat will hold it in place, and then you can wrap something around there. Finger splints, you can use the finger next to it as a splint. So you use, just like with the good leg, you're worried they're fractured this finger, then you could use the finger next to it, tape it together. We call that buddy taping it, but that'll keep it in place until they can be seen. Earaches. Most earaches are caused by fluid in the middle ear. Treatment, vaporizers, decongestants, if they're over the age of 5. If you notice, for the last 5 years or 6 years, you can't even buy decongestants anymore for children. The FDA has removed them from the shelf. On the average, we were averaging about 1,600 to 2,000 children a year being overdosed by parents and loved ones trying to take care of their colds, and they were overdosed with the decongestants. If you're traveling to places like Mexico, you still can find some of those decongestants for children. Don't use them. If the child has a stuffed up nose, you can buy saline spray that you spray it up there, let it sit there, and then have the child blow their nose. That'll work better than some of the decongestants that we have on the market. Dimetap was a famous one. My son, when he was 3 years old, drank an entire bottle of Dimetap. You know, my wife was giving it to our daughter. She set the bottle down. It looked good to him. It was a nice purple color. And she turned, and the bottle was empty. She took him to the ER. The ER doc was a foreign doc that saw him. And they pumped his stomach. My son laid there while the stomach got pumped, not moving, semi-conscious. And then the doctor says, I don't think he really took any. And my wife's there. If he didn't take any, why did he lay there without moving while you pumped his stomach? And the doctor said he has good tolerance. So, antihistamines, what they do is if a child has an ear infection, you give them antihistamines. It dries up your nose usually, but it will dry the fluid up. Problem with that is then the fluid is sticky and thick in the ear, and it's hard to get it out of the ear. Warm oil can take the discomfort away. That warm drops going into the ear will help soothe the pain of the person having the earache. There's also over-the-counter medications that you can buy at your local pharmacies, Walmarts, that are drops that have some benzocaine in it. And what that does, it numbs the eardrum, and that takes the discomfort away.
What kind of oil?
Well, they used to call it sweet oil, but you could use a mineral oil. You don't want to use, any volatile oils like mineral spirits. I wouldn't use cooking oil because that's something that bacteria could grow in. But the drops you can get at the pharmacy, they're pretty darn cheap.
I have used basil essential oil on the
Okay.
outside of the ear for child's earache and had it work.
And sometimes that will work. The one time, if they're complaining of an earache and you see drainage in the ear, you don't want to put anything in then. Because if the eardrum's ruptured, you don't want oil or even drops from the doctors or from the pharmacy getting into that ruptured eardrum. Swimmer ear, the best solution is preventing it. Once they have it, it's antibiotic ear drops to cure it. But when my children came out of the pool every time, I put alcohol, it was half alcohol, half water, put the drops in their ear, let it sit there for about 30 seconds, let it tilt the head, it'll drain out, put the drops in the next ear, let it sit there about 30 seconds, drop out. What happens is the alcohol will mix with the water from the swimming pool and evaporate the water out and prevent the swimmer's ear. And then, let me go back one. You can also, some people will add, instead of the water, they'll add 3/4 alcohol to 1/4 of white vinegar. And the reason the vinegar is because if there's any fungus that they've picked up in the pool, the vinegar is so acidic that it'll kill any fungus that's in there as well. Sore throats. Viruses are the most common causes. Sore throat doesn't mean strep throat every time. I would guess, I don't know, Rick and I work together, but probably 1 out of every 6 to 8 sore throats that I see are positive for strep. Most of the time it's negative for strep. Postnasal drip can cause a significant sore throat at times. Severe difficulty swallowing, fever over 100.9 for a period of time, something that looks like pus in the back of the throat, or sore throat with a sandpaper rash on the skin, you need to see a doctor. The sandpaper rash, that could be anything from scarlatina to scarlet fever. We don't see a lot of scarlet fever these days, but there's some of it around, and it frequently causes heart problems. And so if you've got that sore throat and that rash that when you run your hand over it, it's rough like sandpaper, they really need to be seen. Drinking cool liquids will help soothe the throat. Over-the-counter products like Chloraseptic. Tylenol will bring down any fevers, make them feel a little bit. Ibuprofen will take some of the swelling down to make them feel better. Warm salt water gargles, about a half teaspoon of salt in 6 ounces of warm water. It tastes nasty, but you stir it up, take a swig, gargle with it. It'll help remove any of those exudates or pussy looking things back there, which will help the throat feel better.
Hey Bob, why does salt water, gargling with salt water help? Well, what does salt water do?
The salt water, our bodies are made mostly of salt, and so the salt water helps soothe the throat by removing any drainages back there. Also, the salt water with our body being 0.9% salt helps to soothe and reestablish the tissue back there.
Yeah, I got a comment here.
Yeah.
And some information that you might want to know. I've done some research and I've actually drank it myself. Is apple cider vinegar the natural brand or the Bragg's brand? And a natural cough syrup, if you want to know what it is, it's apple cider vinegar, a teaspoon of that, a tablespoon of honey, and hot water, just like a tea. And that's a natural cough syrup. And that helps soothe the cough as well.
And my mother swears by it also. There are a lot of natural remedies out there that help a lot of people. My mother happens to be into herbs. When she read the story of Rachel in the Bible and how the sun went out with Rachel and Leah and got the herbs and helped his mother conceive in the baby race, the two of those who were happening, that turned my mother very much into looking for herbal treatments for things. And there are a lot of herbal treatments that are helpful. Swallowing the wrong way can cough. Usually if somebody's talking and trying to swallow at the same time, and you'll hear them say, food went down the wrong pipe. When we eat, we have a thing called an epiglottis. It covers the lung while we're swallowing, and when we're breathing, it covers the esophagus so that the air goes into the lung. But talking and eating at the same time don't work. And I frequently have this problem. My wife says I can't shut up while I'm eating. But that can cause coughing, thick mucus, congestion in the lungs. Cough helps to clear the mucus out of the lungs, and that's the body's natural way to get out. Unless when you develop something like a pneumonia, then all the little hairs in the lung that help move the mucus up, and then you cough it out and swallow it, they cease to work, and then in the pneumonia, the fluid, that mucus winds up depositing and developing into a collection in the lung, causing the pneumonia. Coughs aren't always bad, but a frequent persistent cough can make the throat sore and can make you feel miserable. Yes?
With things like pneumonia and strep that you would typically get antibiotics for, what's the best thing to do if antibiotics is not going to be available besides vinegar?
Okay.
That's a good idea, though.
What was a good idea?
Oh, he said vinegar. So in
Okay.
addition to that, what would you say?
Your homemade remedies, but if antibiotics aren't available, if you're talking about a pneumonia, the pneumonia is likely going to get worse. We do have a lot of self-limiting illnesses sometimes. And so sometimes the body winds up helping to heal itself without antibiotics. Sometimes in medical practitioners, sometimes we used to jump too quickly to antibiotics. And a lot of us are trying to curve that a little bit because we used to use antibiotics for viral infections, figuring, well, if it's not a bacteria, then it's not going to hurt the patient. But too frequent use of antibiotics can hurt the patient over time, and they develop a resistance. But if there's antibiotics not available, it depends on what you're treating. Can you give me an example?
Oh, like if my little kid had a cough, like is there a way that I can tell from his cough that it's pneumonia or he just has a cough? And then if it was pneumonia, like you just wait it out if you can't get antibiotics? Or are there any other things I should do for him?
Kids have lots of coughs. If they have a pneumonia, they're going to have the high fever. They're not going to have a good appetite. They're not going to want to eat at all. They're going to be sleeping a lot. The child might wake up pretty active in the morning because children have a high resistance. But by the time the sun's going down, they're going down and sleeping a lot. And so if you don't have access to antibiotics, getting them to rest, drinking plenty of fluids, trying to get food into them. But fluids is a biggie here in Arizona because when they're sick and you're not taking fluids in, even in the wintertime, we have a dry climate here, and it's easy to dehydrate quickly. And so I don't worry so much about if mom says they're not eating or they say grandma's not eating, but it's important to try to get the fluids into them.
And is there a difference in how that cough will sound?
There is a difference in the cough, how it sounds. Sometimes it takes a stethoscope to tell the difference. I've heard moms tell me that they put their ear against the chest, and when they hear that rattling in there, but especially if you're hearing a wheeze in there also, a wheeze means they need to be seen quickly. If it's a dry cough, where there's nothing rattling and they're not coughing something up, frequently that's a cough that's going to pass. But occasionally if it goes on long enough, it could develop into something, especially if another child coughs on them. But that loose rattle sound in the chest can be a concern sometimes.
One more question on that. Why is it that with pneumonia, with older people, they develop because they lay down a lot or they're down a lot? Why is that?
So I'm sorry, can you repeat that question?
In pneumonia in older people,
Okay.
when they lay down, when they're in the bed a lot, that's what it develops. Why is that?
If they're lying down too much, sometimes fluids will accumulate in the back of their throat and slowly work their way down. Also, when you're not active, your body gets very complacent, and the little hairs called cilia in the lungs aren't going to move the mucus out. Every day of our lives, we produce mucus in our lungs. If the mucus doesn't come out, then pneumonia can develop. Older people have a lower resistance, and their activity is decreased, and so that can predispose to them leading to a pneumonia. But it depends on what you call older people. This past July, I had pneumonia. And when I was 20, somebody in their 50s was old. Now I'm in my 50s and later 50s, and I look at it, somebody in their 90s are old. But older people do have lower resistance, and they tend to develop pneumonias quicker. And so you'll see the ads about getting the Prevnar 13, getting their Pneumovax shot for anybody that's over age 50, so that it can help prevent the pneumonias.
Another thing with that is that when you're weaker and you're getting older and your muscles atrophy, the muscles around your throat and your epiglottis that protect your trachea when you swallow also weak, so there's a higher risk of aspiration. You can get aspiration pneumonia. And a lot of people, that's a big problem in hospitals too.
And aspiration pneumonia is when food or liquid goes down into the lung, and then the pneumonia is caused by that. And we've all choked and coughed when a little bit goes down, but if a lot goes down, it can cause a serious aspiration pneumonia, and some people, don't survive that all the time.
I have found for a long time that the best thing to use for a cough is a tea with honey and ginger. It works every time for me.
I like peppermint tea with honey, and it helps my cough, but
And there's probably some coughs that are more serious that wouldn't affect.
Yep.
But if you feel one coming on, you have that feeling in your throat, you just take an inch piece of ginger and peel it and then dice it fairly thin and put a teaspoon or two of honey in there and then pour hot water over it and let it steep for a few minutes.
I've
Very
never tried the
soothing.
ginger. I know my mother swears by the apple cider,
Yes.
but I just can't get that past my tongue. Yes, ma'am.
This is an old question. My dad had pneumonia when he was a little boy, every year for about 5 years in a row, and they put mustard plasters on him. Is there any benefit to that?
No.
Okay.
There's a lot of things that we call old wives' tales that people believed helped a lot. But today we're into what's called evidence medicine, and that's, we want to prove that something does work, and a lot of those old wives' tales didn't work. The mustard plasters didn't work, but it made parents feel better because they were doing something. If you ever seen the old movie and a wife's going into labor and they tell the husband, go get me, boil some water. The boiling the water wasn't to do anything with the delivery of the baby. It was to keep the husband busy while the doctor delivered the baby. Treating coughs, we went over a lot of this. When the mucus is a problem, increasing the humidity and something like a warm vaporizer, Mucinex, Robitussin DM, drinking plenty of fluid, especially here in dry climates, sucking on a lozenge. If you don't have access to a cough drop, a Halls, sucking on a Lifesaver, keeping it moist back there will help a cough a lot of times. Antihistamines usually make a cough worse because they dry things out too much. Barky cough in children, where they sound like a dog or a puppy, that you can take them in the bathroom, turn the hot water shower on, and when they start breathing that steam, that barky cough will go away. And that's frequently caused by something that we call croup. Rashes are tough. Diaper rash, keep the area dry. Keep the diaper off the baby if needed. Sometimes that means accidents on the floor but keeping that area dry, using zinc oxide will help dry it out. But once that diaper rash dries up, it'll go away. Diaper rashes occasionally or sometimes more frequently can get a yeast in there, and the yeast won't go away. And then sometimes if you've got it where it's dried, and especially in the creases of the groin or in the creases of the fat folds, that it's still red, or it's red with little red dots extending beyond the redness, that could be a yeast infection there, and you'd need to get a prescription item or some type of a cream to get rid of the yeast. If the rash is red in the groin area, red dots beyond, fungal rash, the meconazole creams work. Heat rashes, keep the area dry. If powders are used, or baby powders that are used can damage a baby's lungs. And so I can remember my mom with my baby sister, the baby powder went on. It was a big puff of smoke when she was diapering the area. Back then, we didn't know that it caused damage to the lungs. And so if you're going to use something like a baby powder, you're going to want to shake it gently to keep it in that area to dry it off. But you don't want that big puff of smoke where the child's breathing in the powder. A moist rash on the feet between the toes frequently is athlete's foot, which is a fungus. Lotrimin cream is over the counter. We have a lot of over the counter drugs that 30, 40 years ago that we didn't have. Wash the feet daily with soap and water. Use the Desinex spray or powder. The Desinex powder is nice to put into your shoe, sprinkle it around, and then you can dump it out and let that sit overnight, and that's killing the fungus while you're sleeping. The Desinex spray works well, or the Lotrimin sprays between the toes. But when you use these sprays and creams, you always want to wash the area with soap and water, dry it, and then put it on. Because if you're putting these lotions and creams on over top one another, the old coating can, when it becomes neutralized, it will block the new cream from getting to the area. And so you always want to remove that old cream. Yes?
If any of these rashes go untreated, what can happen? Like if you don't treat a yeast infection in a baby, what could happen?
We've all heard the stories of these flesh-killing bacterias, and if you let things go too long, sometimes they can get worse. And if you've got a rash that's a fungus, it causes the break in the skin. You can get what's called a secondary infection. And that's where a bacteria then gets in, and now besides having just a yeast, you've got a bacterial infection also. And then one of the big problems are we have a lot of diabetic people these days. And diabetic people, sometimes they can have that yeast infection and their nerves are a little dulled because of the diabetes and the high sugars, and so they don't always feel that. And so if you've got diabetes, you want to look at your feet every day to make sure you don't have something going on that you're not feeling. Yes, sir.
I guess I have two questions. One, if for that kind of like yeast infection, like in between the folds of the skin, can you use like vinegar, like wiping it down with like a vinegar towel or something?
Some people have used that because the vinegar will help kill the fungus.
Yeah, if you have
but it's
nothing
going
else in the
to
world.
burn like all heck.
But would it work?
Would it work?
Yeah, would it stop it from progressing into something worse?
If you're going to use a white vinegar, I wouldn't use an apple cider vinegar because you don't want anything that's nutritious to that fungus, and that's going to feed it. But the white vinegar, I'm not going to say that it'll totally cure it.
Yeah.
We use a solution called Dombaro's solution, which is similar to vinegar, that people can soak their feet in and kill funguses.
Okay. And so my second question is, and pardon my ignorance on the subject, but if I had cut my finger and I began to get an infection in it, at what point would the infection look bad enough to where I might have to lose my finger and cauterize like what's left?
Okay. Well, one, don't do that.
Okay. So I'm honestly curious.
If it's getting infected and it's fairly red and swollen, you really want to get that looked at because you don't want to get it worse. Diabetics, again, if they get an infection in the foot, it can turn to gangrene. My wife's mother was a diabetic, and she died at 34 years old because she cut her foot, didn't take care of it, and she was what we call a brittle diabetic. They had real trouble controlling her sugars in the 60s, and so it got infected, and they cut the toes off first, then the foot came off, then they cut it off at the knee, and then shortly after that, she wound up dying. They just couldn't get it under control. You don't ever want to lose toes, fingers, feet. If it starts getting swollen and red, if you see pus draining from it, you want to get that looked at. You don't want to say, oh, it's going to get better with time.
But
Bec-
if there's no way to get it checked out,
If there's
just
absolutely,
give- yeah.
positively no way to get it checked out,
yeah, worst case scenario.
you know, it's painful to do, but if you reopening the wound, allowing that pus to come out, and then irrigating the heck out of it with water to clean it out,
Okay.
that'll bide you some time, but eventually you're going to need to get checked.
Okay, so just keep at it and pray for the best.
But if you're out at Boy Scout camp or Young Women's camp,
Yeah.
and you can't get somewhere right away, and you're there for a while, reopening it and draining and irrigating it out will bide you a little bit of time.
Okay, thank you.
Children frequently get something called impetigo. It's caused by strep and staph, and the cut or the wound, particularly on the face and the other areas, it'll look like dried honey, and that's a classic sign of impetigo. And so impetigo is going to need an antibiotic because washing it with soap and water, as the child touches it and then touches another area, it'll wind up spreading. Children with leg pain, especially in the evening, what used to be called growing pains. And in the 60s, doctors would have lab work done, x-rays, big workup on these children with growing pains. In the end, what they found works well. Children with aches, you can use Bengay. That sensation of heat will take the discomfort away. To prevent it, I tell moms all the time, if your child is really active during the day and having this problem with leg pains at night, sit them in a warm tub for a good half hour before going to bed, and they probably won't have those leg pains that they have. There's nothing serious about them other than it's waking mom and dad up in the middle of the night. Mom and dad don't get a good night's sleep because they're trying to take care of the child with the leg pains. Anytime mom and dad aren't getting a good night's sleep, it's not a good night for the whole family. Nosebleeds causes, particularly here in Arizona, drying of the mucous membranes in the winter months, and then they crack open and they bleed. The nose has a hard, bony part and soft part of tissue. Treatment, squeezing the nose below the hard portion up here between the forefinger and the thumb and holding that there for 5 minutes. I have a lot of patients say it's easier said, but some people start getting cramps in the fingers after 5 minutes. Switch hands and put pressure on it to stop it from bleeding. Putting ice across the top of the nose will cause constriction of the blood vessels and slow down the bleeding. Try to avoid taking tissues and packing tissue after tissue after tissue up there. We'll do that with specialized packing in an ER or at a doctor's office, but Kleenex tissues are not the best thing to pack the nose with. If you couldn't get it to stop bleeding and there's no other way and you were a good distance from a doctor's office, yeah, you could do it, but we worry about infection developing because those tissues are not sterile. Yes?
What about the clot that develops? I've heard that you're supposed to pull that out.
Don't pull it out.
Don't do that.
If it's clotted, as soon as you pull it out, you're now exposing that fresh bloody area and it just starts bleeding again. A lot of times if the clot's there, the clot is nothing but that blood that's coagulating, and it's acting like a Band-Aid sometimes over that. And so as soon as you remove the clot, it's going to start bleeding all over again.
Okay, thanks.
But bloody noses can scare parents. And it takes a lot of blood to lose enough, a lot of bleeding from a nose to lose enough blood to cause a problem. And generally, the ice or pinching it off, if you can't get it to stop with that, and you've been going at it, 30, 40, 50 minutes, that might be time to take them to the ER. If you're out in the middle of the woods, again, if you have to pack the nose, you can pack it. But if you're going to put tissues on it, I'd put some Vaseline on the tissue strips and put it up so that the tissue doesn't get dried up there. And then when you remove it, it just causes the bleeding to start over again. But again, that's not something I would use in our homes in Gilbert because we have medical places close enough. And generally, pinching that nose or the ice in more than half the time will slow down the bleeding or stop the bleeding. Yes, ma'am.
Is there like a size of a clot that might come out that's like worrisome, or does it not
A size clot that what? I'm sorry.
Example, my son had a nosebleed. It had lasted for, longer than 10 minutes.
Okay.
At one point, he's 5 years old, so he had quite a large clot. At one point,
Hanging out of the nose? Or
that came out, and then it kept bleeding. We didn't pack his nose or anything, but we were just, applying pressure. And at one point, he had a very large clot that came out of his nose, and it kept bleeding again, so we applied more pressure, and another clot came out. I mean, obviously it looks scary. So is there a point?
you see that large clot and you go, oh my gosh.
So is there a point where that is like really bad, or?
The clot's
As long
not,
as it stops
the
bleeding,
clot's
it
not the
doesn't.
bad part. It's the nose not stopping to, with the bleeding. And if it's bleeding in this part of the nose, it's coming out this way. If it's high enough out, the blood's pouring down the back of the throat, and blood in the stomach can cause the child to get nauseated. Then they throw up the blood, and then you're really panicking because is it from the nosebleed or he's now bleeding from the stomach? And the answer to that is it's the blood going from the nose down the back that's making the stomach queasy and vomiting. But I've had parents talk about where I've said, don't pull the clot out, but if you've got this huge clot that's already partly hanging out, you can take a pair of scissors and snip off the blood and let that portion, but just don't pull the part out of the nose itself. And again, if you can't get it to stop, you might wind up visiting the ER and paying that $200 or $300 because there are some people that the bleeding just doesn't stop, and those people need the professional medical help. Have you tried with him pinching off? Because this area inside the nose is the most common area that'll bleed, and so when you're pinching it, you're just putting pressure on it and holding it there long enough. But to prevent it, drink lots of fluids, and the saline nose sprays, spraying that up every few hours will keep the nostril moist so it doesn't crack and bleed.
There's even a saline gel that I use
when I Yep.
fly on an airplane to keep them from getting too dried out.
There is, and that works well also as a prevention. I see a hand up in the back.
Is using a tampon a viable option?
Well, not with a child. I've used tampons when I was in the middle of nowhere and somebody had a good laceration that was deep on the abdomen, and put it in there and it swells and absorbs, and put pressure on the inside of the wound while I was putting pressure on the outside of the wound. But using it, most of us don't have a big enough nose that a tampon would go up there fairly comfortably. And you could cause more damage by putting something up too big into too small of a hole of the nose. And so I probably wouldn't do that. Yes?
If a nosebleed won't stop bleeding and you bring them to the ER, what do they do at the ER to stop the bleeding?
Well, when you're in the ER, they can put a tube up there and then inflate that tube. Inflating it puts the pressure on the blood vessels and stops the bleeding. Sometimes we'll use Vaseline gauze. It's a sterile, It's covered with Vaseline, and we pack it up there. But because it's Vaseline coated, we bring them back usually 24 hours later, and then we'll remove that packing from their nose. And because it's Vaseline covered, it'll come off. The Vaseline never sticks to the area that was bleeding, and so there's nothing ripping off that area causing it to re-bleed. But it's pressure. So even in the ER, it's pressure we use. If pressure from the outside doesn't work, then we're using pressure from the inside by putting up something up the nose and then inflating it.
Do they cauterize anymore?
We occasionally, if you just can't get it and you can see where it is, we'll cauterize it. In the ER, we'll frequently use silver nitrate to cauterize it, and it works well. If that doesn't work and electrical cautery has to be used, usually we'll bring in an ENT doc to do that. Yes, sir.
Does a frequent nosebleed in a particular child have anything to do with a more serious blood issue?
Rarely it can. Most commonly, it's the child's not taking enough fluid in and the mucous membranes just aren't moist enough. Toothaches can be from poor dental care. Sinus infections can cause toothaches. Dental abscesses can cause them. Ibuprofen is one of the best things for dental pain. It works really well. And ibuprofen also, women that have menstrual pain, ibuprofen works well because in those areas the body has receptors that the ibuprofen can attach to and get rid of the pain a whole lot easier. And so I've seen toothaches that we couldn't get rid of with narcotics respond to ibuprofen. And so ibuprofen is a good temporizer. If the pain is consistent, you're eventually going to have to see a dentist so that the cause is removed that's causing the toothache. Yes?
Sorry. Mine pertained to the nose. Is that why you're not supposed to lay him down? Because it might, when you're putting the pressure, they may have a clot and may cause them to choke. Somebody said you're not supposed to lay him down, like when they have that bloody nose.
I'm sorry.
I had a niece that fell down.
Okay.
And she had severe bloody nose because from the fall.
Okay, from the fall.
And the mother laid her down. They said you're not supposed to lay him down because she could have died because of the clot. So are you not supposed to lay him down like when they have that severe bloody nose? You're just upright, or what? How are you supposed to have him?
Well, if you lay him down, the blood could go down the back of the throat into the stomach, and then enough blood will irritate the stomach, and then they'll be vomiting. And so generally, if they've got a nosebleed, you want them in a sitting position and let them bring their head forward and pinch it off, or pinch it off and have ice pack there also. But yeah, you don't want to lay them back where the blood is pouring down the back of the throat. Low back pain. As we get older, a lot of us have it. Overuse can cause it. Menstrual cycles can cause it. Frequent cough can cause back pain or chest pain. And that's just because that cough is stretching those muscles and you wind up straining the muscles in your back or chest. Ibuprofen works well. Moist heat to the back. If you have a heating pad, don't put just the heating pad on it. The dry heat warms the skin, but you want a penetrating heat. And so take a towel, dip it in warm water, put it to the back, and then put your heating pad over that so that moist heat will penetrate into the muscle more and give them some relief. Sleeping with folded towels beneath the low back or something, a pillow, something giving some lumbar support if it's a low back pain, or sleeping on a firm bed, sleeping on the floor. My brother-in-law took a door and stuck it under between his box spring and his mattress to make his mattress firmer to help him with his back pain. But firm mattresses, anything firm sleeping on it is going to help that back pain. Nausea, vomiting, and diarrhea. Diarrhea can be presented for various reasons. Medication in elderly commonly can cause it, virus in children's. In the winter months, we have the gastroenteritis, which is a virus that causes the diarrhea, the vomiting, and ruins mom's lives for several days. Treatment, day one, put them on clear liquids. If you can see through it and drink it, they can have it. In the ER, I say if you can see through it and drink it and it's non-alcoholic, you can have it. Jello counts as a clear liquid, and so the clear liquid is going to rest the stomach and rest the intestines. Generally, after 24 hours of clear liquids, then you can add what we call a brat diet, which is bananas, dry toast, applesauce, and rice. So if you put the banana, rice, applesauce, and toast, that's where we get the brat from. And so those things are gentle on your system. So 24 hours of the clear liquids, then you're slowly introducing solid foods by introducing these 4 items. When we say toast, that doesn't mean toast slathered with butter or margarine or jelly. We're talking dry toast. So take the toast, spread some applesauce on the toast. That'll give you some moisture without having to put the jam or the butter on it, which will only irritate the stomach further. Infants, you can use rice water, and of course there's the ever-loved Pedialyte that we use with the infants, but Pedialyte is not cheap. Generally, if the child is over 2, I'll use Gatorade. Yes, Gatorade has some sugar in it, but it's fairly low sugar, and they can tolerate that well. I don't use red Gatorade in children because if they vomit it, it frequently panics moms. Hawaiian Punch and red Gatorade or anything red, and a child vomits, the first thing mom thinks of a lot of time is blood. And so avoid using those type of drinks. Belly aches, causes from viruses are the most common. You can see the word severe is spelled real well. Severe infections like appendicitis can cause it. Rule of thumb, if the abdomen is soft and the pain hurts with pressure on the abdomen and is relieved by removing the pressure, you've got time to get to a doctor. You know, if I'm worried about appendicitis, I'll push down and say, does it hurt more when I push down or does it hurt more when I let go? And when they say it hurts more when you let go, you need to get them to a hospital. But if the belly is soft and not firm and they're not having a lot of discomfort when you're poking on the belly, then it's usually nothing serious. Serious things like appendicitis, like I said, push in, let go. Tap on their heels, a firm tap on the heels, and if they say, Mommy, Daddy, that makes my belly hurt, then that could be appendicitis, and you'd want them seen by somebody. Tapping on the feet, or I'll tell them, go up on your toes and then drop down real hard. And then when they go, ugh, then that could be appendicitis. Or you could take their hips, shake their hips, and if shaking the hips makes the belly hurt, you know, any of those things, you want to get them to a hospital. But generally, if the belly is soft, then it's usually something not too serious. But if the belly is soft and it's hurting day after day, by day 3, if the belly's still hurting, you probably should get them seen. When you have that belly pain, the one thing the hospital always asks you is, when was the last time you had to eat or drink? If you drink too much fluid too fast with a bellyache, they're going to vomit it up. And so if the belly's hurting or they're nauseated, have them take small sips of the water. A bowel movement and passing gas may help. Antacids may help. You have Gas-X. It's amazing the amount of pain gas can cause in our stomach and in our intestines. You can take a set of intestines and chop it up with a knife and the patient won't feel anything. But you put gas and start putting pressure from the inside out, and you have horrible pain. And so Gas X has a medicine called simethicone in it that'll break that gas up. And so if you tap on their belly and it sounds like a drum, but they're not running a fever and they are having bowel movements, then sometimes something like that will breaking the gas up will help. Also, drinking sips of, take ginger ale, get the fizz out of it, pour it back and forth and up until it's flat, and then small sips of that. The ginger in it will help break up gas also. That's the last slide. I was ready to go another hour, but any other questions we have?
You could just wait for the mic. That would be great.
Is that true that when you feeling like have a heart attack, you need to start coughing so the heart can have like exercise? Is what they said. People say that, so I don't know if it's true or not.
A hard hug with what?
Yeah, if you feeling like it's a heart attack, start coughing very hard.
Okay.
Is that good?
Well, coughing really hard, other than it can make you short of breath, it can strain the muscles in the chest or the back, but it's not going to cause, some people say you cough, your heart's going to skip a beat. And it's not going to do anything to the heart. Coughing too long of a period of time makes them very uncomfortable. And so if you've got a persistent cough that just won't go away, then you want to get them seen.
No, but you cough. So
I think, no, it's all right. Yeah, if you're having a heart attack, is it recommended to start coughing vigorously if that will kind of like on purpose to maybe, jumpstart your heart per se?
I've heard that, but I can't say that there's a lot of science behind it or not. There may be, but I don't know the answer to that one. But if you're having chest pain and along with the chest pain you're sweating or you're feeling nauseated or the pain is going up to the left shoulder or down the left arm, you really need to get seen. The biggest problem with that is women sometimes will have what's called an atypical heart attack. So a woman or a diabetic can have a heart attack where they have very few symptoms. I had a grandmother come in once in the ER and I said, "What can I do for you?" And she said, "I don't feel well." And I looked at her chart, and not only was she female, but she was diabetic. And ran through a couple things, did an EKG, and sure enough, she was having a heart attack. And so I can say with a surety, if you're a man, usually you're going to have those symptoms with a heart attack, but women, especially as they get older, don't always have all the symptoms. And so if there's a discomfort that's just not going away, you want to get it checked out because the majority of people that are going to die from a heart attack are going to die within the first 2 hours.
Real quick question.
Yes, sir.
If you are, let's say you mentioned, girls camp or scout camp or something like that, or if there's some kind of a regional emergency and access to a doctor is not very readily available, and you get severe cuts and so forth, can you go over how you would address that?
Okay. Probably the same way I did when I was 14 at scout camp. You learn to whittle at scout camp, and I whittled into my finger, and it was a cut that really should have had stitches. Clean it out with soap and water. Put a dry dressing on. And when I say dry dressing, if you don't have something sterile, you can use a handkerchief or something. Boy Scout camp, they have the neckerchiefs that they wear frequently. But putting pressure on it, usually enough pressure for a long enough period of time will stop the bleeding unless you've cut an artery. If you're talking in the fingers, the tiny arteries in there will usually respond to pressure also. But clean it out with soap and water, irrigate it out well, and then dry it and put pressure on it. And then once you see that slowing down, you can put that pressure and If you have tape that's made for dressings, you can use that. You could use duct tape. A lot of people have duct tape in their cars, and tape a dressing on that because you want it tight enough where the pressure will help stop the bleeding. If it's bleeding somewhere on the torso, not on the arms or legs, it's, again, you're cleaning the wound out and then putting pressure on it and holding that pressure sometimes until you can get them somewhere. If you're putting enough pressure on it and you see the blood bleeding is slowing and stopping, then you know you're getting ahead of the game. But it's applying the pressure for long enough to get the bleeding to stop.
Are there things that we could purchase for? Are there things that we can purchase for emergency kits that you might recommend that we could keep with us if we have a kit in our car or at our home or something?
Tiny first aid kit. John has done many a lecture on having a good first aid kit at home in your car, because that first aid kit's going to have some various size dressings in it. It's going to have tape in it. Generally, it's going to have some type of antiseptic in there, so that if you don't have the soap and water, alcohol is a good antiseptic, just burns like all heck. But keeping a small first aid kit is helping to prepare for that. You go to girls' camp or Boy Scout camp, you always want to have a first aid kit with you, because a lot of these camps, they'll have somebody who's a medic there, but when you're out on that hiking trail and you're taking on that 6-mile hike, it might be halfway through the hike when something happens like that. And so you want to make sure the small first aid kit is something that's easy to carry with you. But because if you're out on the trail, you don't have access to soap. Maybe some water in a canteen that you can irrigate the area with, but putting pressure on it. And generally, we don't want to put pressure skin to skin. And I'm not saying that because I want to contaminate it with one. It's just, I'm cut here and I'm putting pressure with my bare hand. It's going to stick, and as I pull it away, any clotting, it could rip it away and start it bleeding again. And so if you have a towel, a dressing, a handkerchief, anything that you're putting pressure on, when you remove that hand, the dressing or handkerchief towel is still there, so that it's not reinitiating the bleeding by pulling all the platelets and everything. Our bodies are made where they try to stop bleeding on its own. And if you hold pressure long enough, most times if it's not an artery cut, you can get the bleeding to stop. Yes,
we have
ma'am.
One last question before we close. Otherwise, I think the basketballers are going to kill us.
We've got at least 3 teams here.
What are your thoughts on products such as quick clot and such for really bad wounds such as a gunshot?
They can work. The Army helped to develop a lot of those quick clot things where you sprinkle the powder in there, and it's helping to create an artificial clot as well as the platelets working. And so if you're going to use something like that, read the directions on the package, but they can be very helpful.
There's a second one. I can't remember the name of the second one I heard about.
There's several out there.
Doesn't burn like quick clot, apparently.
Yep.
It burns.
Quick clot burns, but if you're in the middle of nowhere and you're having trouble to get it
You're
to
hollering
stop.
because you've been shot anyhow.
They're on the 3rd generation now.
Okay,
they've gotten rid of that exothermic reaction.
Okay.
Because not only would it sting, the patient would tell you that it felt really hot or sometimes burning with the 1st generation.
Okay.
Putting what? Cayenne pepper? No. You'll get a reaction from the person, all right. But yeah, cayenne pepper isn't going to help it clot.
All right, we're gonna close it up. Thank you so much, George. We really appreciate it. We'll try to get this.
Give me 30 seconds. There are a lot of good books out there on how to take care of yourself with a lot of the things that I've gone over. Kaiser Permanente has one out, but there's probably a good dozen books out there that you can purchase that are all paperbacks that when something happens, you can have a quick reference at home, in the car, at a camp, on a hike, because there's a lot of good information on how to take care of yourself. And the books are not terribly expensive these days. Okay.
Thank you, George. Thank you. And the same books you brought last time,
Yep.
put those on the video. That I took pictures of them last time.
Okay. And you could add it to the website.
Perfect. Okay, I will do that because he had some great books last time that he highly recommended. Okay, so we'll close up with a prayer, and Jared volunteered to do that. Thank you.